Morning, Vijay. Morning, Prof.
Hi, good morning.
Morning.
So I'm just checking. Who is there? My share screen. Okay.
Karen will be the one to deal with it.
Yeah. What time is your work, Shanti?
I'll be leaving, but I'll be listening to you on the phone. So 9 o'clock.
Okay.
Half an hour I can listen to you.
Okay.
Good morning, ma'am. We are waiting for HOD, ma'am. Once she comes, we'll start the session.
Okay, ma. Okay.
Thank you.
Good morning, doctor. You have to unmute. You have to
Morning.
unmute.
Yeah. Good morning.
Hello, Dr. Shanti. Back to back.
Morning. Yes, yes. It's very addictive.
Thank you for sparing all your time. We are really honored and proud, all professionals even attending the program along with their students.
There's so much to learn. There's so much to learn from you all.
That's what the students also have to understand how much we have to keep updating ourselves, how much ever our experiences because of the changing, so many things are changing.
Yeah.
Absolutely.
Environment,
Absolutely.
world, the pandemic changes, and we have to keep on updating ourselves. So thank you so much. Karen, Karen, can we start the program? Ma?
Yes, ma'am, we can, ma'am.
Who's going to do who's the MC?
Ma'am, someone's phone is echoing.
Someone? Okay, we'll start, Ma, with the introduction to Dr. Vijaya, because we will miss her timing, otherwise they have to rush back. Yes, Jaya?
Good morning, ma'am.
Yeah, start. Who's going to start?
Welcome, everyone. Dr. M. Vijayarani is a
Loudly, we
graduate.
can't hear you. Your video is also
Okay.
not clear.
My net is very slow, I guess, ma'am. I'm not sure.
Yeah. Come closer, maybe. Little closer. Your lighting is not okay in the room.
Maybe, yeah, ma'am.
Okay, start.
Dr. M. Vijayarani is a graduate of medicine from Stanley Medical College, and she is a postgraduate diploma of pediatrics from Madras Medical College, Institute of Child Health, and she's a diploma. She did a diploma in adolescent pediatrics from Kerala University, and Dr. M. Vijayarani is a practicing pediatrics and adolescent health consultant for the past 18 years in Ranipet through Snegam, a guidance and counseling center for children and adolescents. She's a director of schools in Vediketan and Pinkushan Monastery School, and she authored a chapter in IAP Adolescent Health Academic Module, Office Practice in Adolescents Pediatrics, and she also published an article on parenting in IJPP, and she published articles related to behavioral issues of children and adolescents in newspaper and journals. She has conducted many awareness program on issues related to adolescents, HIV and AIDS, and scholastic problems, sexuality in school and colleges in the district of Ranipet and Vellore. Thank you, ma'am. We welcome you for our webinar.
So just to add on, if you look at these panel of people who are giving webinars, it is not that they are doing their only medical, whatever they have done. Though they are pure medical person, they are always involved counseling and other modalities of therapy, like Dr. Vijay Rani, Dr. Shanti Raj, Dr. Shanti Shairam. They don't just stick with their medical model. They are inclusive of all models and also in the teamwork. Dr. Vijayarani also so much she calls for, I mean, long back. She's been doing this for a very long time. She's been having in her clinic, she's been having a team. She always includes the psychologist. She invited me for assessments very long time back because especially these pediatricians are the core people who receive these people with developmental disabilities. But I would have to frankly and openly say, not all pediatricians identify. Many parents have told us this because early diagnosis is one of the key things where we can identify and we can intervene very early. But however, they've been shared with us till the age of 7. It's okay. They don't even refer a psychologist or a psychiatrist or somebody. They think it's all okay. If the child having showing symptoms of ADHD, it's okay, he will outgrow. If his speech delay, okay, they will talk later. Adela, don't worry. And the mother, even now, I'm talking and I'm just sharing with my experience. Even now, it's not just past 10 days, 10 years. With all this awareness, I think we all have the responsibility, social responsibility of creating this awareness, like Dr. Shanti Sairam, Dr. Vijaya Rani, and Dr. Shanti Raj, who is vehemently working on that because they started this kind of practice long back. Very few people, I would say. We have to get in more. The medical model has to be inclusive of other alternative models also, or models of therapy for any kind of good A positive interventions. With this note, I think she also runs a school and she does many other works, philanthropy again, I would say, apart from their medical service. Yes, which is generally, actually for the parents, especially the doctors and especially the pediatrician are like gods. They are the god. Even I had felt it when my child is sick and when we go and then he becomes okay. We really think we attribute to the pediatrician. So it's like, no, they're all gods. We all parents look at them at the top gods, but very few people, I think, also include all the other alternate medicines, which we have to bring in more awareness, which is more of the theme of this mental health day, or access to everybody and reaching and bringing more awareness. Thank you, Dr. Vijayarani, for accepting our time and also giving your time. Past two presentations, I've seen you attending with all your busy schedule. We will start the session.
Thank you so much. At the outset, let me thank Dr. Professor Thenmuri, who's the HOD of this Department of Counseling Psychology. And I must also congratulate her for the beautiful session she had been having, and which is a continuum, fetus to geriatrics, and she's also involved the pet therapies and other things, and also the other activities. It's this whole thing is beautifully done. I'm sure I must congratulate your team.
It's all the students. Everything
The
was
team.
maybe the topics, choice of speakers I did, but everything, the teamwork, and Karen is a main person who's been continuously past 20 days. She's working on that very beautifully. All of them in a team, and they are working together. Because I also always feel that education is just not reading your subject and getting good marks.
Absolutely.
All-round development of involving yourself in sports, arts, and organizing such programs, coordination. Very beautifully they are doing. I'm proud of my students. I'm proud of my department for this. Thank you, Rani. Sorry for interrupting.
No.
We can start.
Yeah, thank you. So I will just
Share your screen.
how do I? How do I share?
If there is share, you can just click on the share, and you have to keep your PPT open, downloaded and open in your desktop.
Open your
It's
PowerPoint
there.
first, Vijay. Then
Okay.
there'll be a green arrow called share, slide share.
You have to
Share
click
no.
in that box.
It's
You
there.
click on that.
One
When
second.
you click on it, you have to choose the exact application that you're sharing.
First PowerPoint, you just keep it open in your desktop.
Okay.
Then come back to Zoom. And there'll be a green arrow saying share. Share screen. Share content notice, in a rectangular box square. Click on that. Then you'll have to choose your PowerPoint. Got it, Vijay?
1 second.
What happened?
I'm only seeing your thing. Yeah, share screen is there. I opened my, here, yeah.
That's it.
You're able to see, oh yeah.
Wait, it's loading, it's loading.
Okay.
Yes. Yes, go to slideshow now.
Yeah.
Yes.
So, thank you so much. Like I said, the whole content, the theme this time they've selected, mental health for all, greater investment and greater access. That's a wonderful theme. And by doing all this, we are celebrating, we are observing World Mental Health Day, World Suicide Day. This all shows the importance we have given to this aspect of life, and how much it is important, uh, knowing the magnitude of the problem. And it's really a pleasure to talk to the budding psychologist, young people who are going to handhold people with challenges in future. And also it is very important to understand them. That is the main thing which I'm going to concentrate on today. And by the end of the session, I hope I give you an overview of the definition of adolescents and young adults, importance on investing on them, what are the stages of adolescence, neurobiology of their brain, mental health in young adults and adolescents, and the protective factors. So yesterday, the lot of things were spoken about anxiety, depression by Dr. Shanti Raj. So I would speak more on the protective factors, which is more important to be given to the adolescents and young adults. So, why is it important to really define the age? The adolescence is the period that is happening between childhood and adulthood, and it is the transition period between. There is always uh, changes that is taking place, and we must know during which period it takes place, because any deviation is an alert. So adolescents are children between 10 and 19 years by WHO, and youth are those between 15 and 24 years, and young adults are between 18 to 25 years. It is also very important to know these age groups, because by Indian legal system, all persons less than 18 years are children. And it does it mean that those above 18 years have reached adulthood, or almost, are they full blown adults? No. So as we go by, we will see why we cannot really treat them as totally adults. And that is why this concept of young adults, we are integrating. See, even as pediatrician, I'm not restricting myself to 18 years, but we want to talk about young adults also, because it is continuing to up to 25 years, or even sometimes beyond that. I see no hope for the future of our people if we are dependent on the frivolous youth of today. For certainly all youth are reckless beyond words. When I was a boy, I was exceedingly wise. This is said by Hesiod, a Greek poet in the 18th century BC. I'm sure all of us would agree. We feel the same even now. If, I mean, most of you are young, if you had dealt with adolescents, and then you would understand the whatever he is trying to say. See, this still holds good. That is because we have not understood them. See, yeah, as parents, when we see our adolescent lying on the sofa, look, with one shoe on, the other one off, and this is a common scene, and exasperated parents. So how parents are also not aware of what is happening. Is this normal or abnormal? So we have the challenge of really equipping our parents to deal with adolescents. So unless we understand them ourselves, we understand what is going on inside them, we will not be able to really give an insight to the parents who are there. So when we see adolescents again, we always think about those kids who break our pains, or who are always coming, going fast in a bike, or up to some gather in a mob and tease people. That is not so. See, they are doing so many positive things which we don't focus. We need to focus more. If you take paper or newspaper or any media, there is so much of negativity around. It's high time we focus on their positivity too. And why is it important? Not just the one or two issues on the mental illness, but see the magnitude of the problem. The whole world, the population, if you take 25% of them are adolescent and young adults, and most of them are in the developing nations and underdeveloped nations. 1 in 6 people are 10 to 19 years. So it is very important, and they are going to be our future adults, and we want a healthy adulthood. Among them, the mental health burden is 16% of the global burden, not only the illness, but the unintended injuries like road traffic accidents and violence, which are very, very high. And it is still increasing. There are a lot of studies, if you see the many, many studies, and I really don't want to talk more on numbers, but it is big. And all this can be brought down only if we talk to them, listen to them. Half of the mental health conditions start by 14 years. Yesterday, Dr. Shanti was asking about how to detect in 5 years child the issues. And if you see, most of the mental illnesses start schizophrenia, bipolar. There is some indication around the age group of 14 years, which goes undetected and treated. And it is very, very important. If you want to give a very good quality of life, almost normalcy, it is important to detect early. And depression, it's very, very shameful to say that India ranks almost on top list, that we have a big burden, and Tamil Nadu really ranks high in depression as well as the suicide rate, especially among our young adolescents. Very sad. And the consequences, it is not that they get depression or anxiety or any other mental illnesses, which may be, as a topic, may seem to be small, but it has a long drawn consequence. It becomes chronic and goes into adulthood, where the quality and the repercussions are not very good. And why adolescence? We have lost already one chance during the childhood, less than 5 years. Fetal life, the growth rate is really tremendous. Then after birth, 1 to 3, it is quite thing. Then it slows. But again, during adolescence, it kicks off the hypophyseal and pituitary and the adrenal axis kicks off during your puberty, which happens in the adolescent period. And we have another opportunity either in the physical growth or in the mental growth, and to really bloom well as a psychosocial being. And you can give a lot of environmental influence and life skills during this period. Also, we must understand this vulnerable, that just like our kids are really vulnerable, same way, less than 5 years, they're very vulnerable. The mortality rates are so high. And different kind of mortality and morbidity falls during adolescence. So we must seize this opportunity on the positive aspects, and definitely all of us together, it is an integrated achievement to be done. So not just the mental health needs good nutrition. A good body has a good mind. So we must take care as holistic approach. And if you see, there is calcium accruing in the bones, and then early lifestyle changes in our nutrition can go a long way, because the cancer cells, which happens nowadays, we are seeing in the age group of 30, 40s itself. Now, what is the understanding is, whatever the changes that are happening in the micro level in the cells happens much early, and that is during the adolescence, when the adolescents can have really poor eating habits. So all these can be changed only by giving good life skills and mental health. You will see mental health is very much integrated into everything, every part of our body and life. And it's very important to identify early and manage mental health diseases. We'll see what the diseases are. Lifestyle nurturing. It's very important, because if we are not going to do that, we already have a burden of non-communicable diseases, now mental illness, so much to handle. And this is the right time to give life skills. We'll be seeing what those life skills are. And all of you as psychology students must be knowing about Erickson's theory. There is a lot of task for the adolescents. First, the independence. We just want to cut our umbilical cord. No more being a child. We've done with that. But can we do it? We are so different. See, pediatrics, human pediatrics is so different. If you see a calf or a deer, as soon as there is birth, if you see a calf, it just tries to stand for some time, and then after a few minutes or maybe half an hour or 1 hour, it jumps around the mother. Whereas in human biology, this does not take place, because the brain development is almost complete and in the womb for the animals. Whereas in human beings, the brain development happens after birth also. So this the dependence is for a longer period, and adolescence is the right time to slowly, gradually move away from the parents and reach the adulthood. So for that sake, the physical maturation takes place as the puberty kicks off. The psychosocial maturation also takes place along with the environmental influence. There is establishment of adult identity, very, very important. Who am I? What am I as a sexual being? What is the expectations of the society, and am I fitting rightly into that? What are my values, spiritual and moral? All these things are not happening simultaneously in each age group. Like, it is not boxed, like 10 to 15 years this happens, 15 to 18 years this happens, not that way. And also, not only age, in an individual, each adolescent is unique. The changes are asynchronous. For one, in the physical maturation takes off early, whereas mental maturation takes a little later. You would have seen many children or adolescents, they will be really grown in height and they will be having mush, everything. The secondary sexual characters are all much advanced, but where the mind is very juvenile, their speech and the way they handle things are very immature. So this is all the incongruent that we have to wait for and handle each and every individual in a unique manner, understand them, and then approach them. That is very important to understand. Yes. So for the sake of understanding, though it is a continuum, we've divided into early, middle, and late stages of adolescence. What happens in 10 to 13 years, they're very, very emotional. So as we see, the limbic system matures early and the cortex, prefrontal cortex, matures late. We'll be seeing that. So because of the early maturation of the limbic system, the adolescents are in the beginning, they're very emotional, and they have a decreased interest in the parental activity, very rebellious with the parents. You can see that 10 to 13 years is a really troublesome period, like the terrible twos of childhood, difficult to handle. And unless if the parents have really some knowledge, or if they have some insight into their own adolescence, they would able to empathize and kind of keep themselves cool with the different changes that is taking place. And also, they are preoccupied with physical changes. You can see them in front of the mirror all the time, combing their hair, and any small thing like acne can be really troublesome. And you can see them in gangs with the same sex, like all the boys together, all the girls together. They are concrete thinkers. We cannot think that you have to tell them very plainly. You cannot tell them long sentences, complicated sentences, complex things. You have to tell them very clearly in small sentences what to do and what not to do. Otherwise, they cannot understand. And then slowly they move on to the next stage, that is middle adolescence. So slowly they move away from parents, like spending time with their peers. There are a lot of parent and conflicts, because if the first stage has not comfortably settled, then there is conflict. but slowly they understand their body that has taken place, the changes that has taken place, feel much better. There is intense involvement with the peer group, so you understand the clubs and teams, but this is the right time to really push them into these group activities on the positive side, and their abstract thinking increases slowly. But I wouldn't say they have a real good abstract thinking now. And you see 14 and 15 years, like they come under 5th, 10th and 11th standard. If many of you know that our academic curriculum, the demands of it are really not congruent with the thinking process. If you're going to talk about the space and then the light years, it really needs abstract thinking. And that is why the scholastic difficulties, it's not that their IQ is low or anything. They need to think beyond what is shown as black and white, so that you should not judge a student with that. That is little bit about abstract thinking. And in late adolescence, see, above beyond the definition, it goes up to 21 years. There is a distinct identity. By now they know who am I, and the female and male models and what is expected, and then they are more accepting to their parents what they are saying. A little bit they kind of, the conflicts are resolving well, if they had a smooth pathway, and less concerned with body image, more sharing and less exploiting in relationship. And this now they are not seen much in a gang. They have selected friends. They have more specific. They know who are like them. They are able to go into that kind of relationship. Also single relationships, and they become more rational and altruistic, and they also know some kind of realism, and their values are also much more refined, and they tend to fit into the whatever the grooming, and this is the right time. I won't say the values are given, and it all depends on the maturity of the brain, what how they are going to accept it. So these are the areas, the all the red marked areas are where we need to work on, as a healthcare professional, especially people dealing with their mental health. We need, because they know they will not get help anywhere outside. We are the people, we are their guardians, we are their gatekeepers, and we have to really take care of them. So next few slides will be on neurobiology of an adolescent brain. We all know the left-handedness, right-handedness, and then the opposite side of the brain is going to be the dominant, because there is crossing of the neural fibers. So if you're right-handed, your left side brain is dominant. And if you're left-handed, your right side brain is dominant. And accordingly, you have the areas which have logical thinking, dominant, and creative thinking on some others on the opposite side. So it is these things will be guiding us in counseling, in really extracting the adolescent what they can do. How you can approach, what are the skills they can emulate. Like we know about the 8 different intelligence, you can motivate them, because these are going to help them in their overcoming their negative, if at all they had really little bit gone away from the pathway. Also, this neurobiology understanding is going to give us a tool to really make them strong. So my professor, his favorite statement is like, ships are very safe in the harbor, but ships are not built to be in the harbor. They are supposed to go into the seas and oceans, where they will be coming across storms and cyclones and torrential rains. And it is not just enough you build the ship, the physical things, but the sails are also very important. I actually akin the sales to the mental health and the life skills we are going to give them, because that is going to really turn them to give them direction, which way they are going to have. They have to really go into the sea. There is no way stopping, but we have to really give them strong sails and the body to move into the sea. So this is the unit of the brain, and what exactly is happening in the adolescent brain is the myelination. So there is plenty of pruning that is taking place during the adolescent period, and this is the second most important chance for the adolescent to bring in maximum potential in learning, knowledge, acquiring knowledge and skills. So the gray matter is going to be less and the white matter is going to increase. And you have to really differentiate. It is not the decreasing gray matter of that of an old person, a geriatric person, but here there is pruning, there is increase. This myelination is like oiling the axonal sheath. It is going to do fast conduction and also building lot of networks. So you more and more skills, more and more learning, there is going to be more networking done in the brain. Extremely brilliant aspect we have understood with the advent of functional MRI. And a little word about functional MRI. We did not have these aids long back. Only in the 90s, we started understanding the brain with the help of functional MRI, SPECT, and more developed gadgets have come today. And a little more about that. See, in the 1840s or some particular year, a decade ago, the cricketers were shielding their testicles with testicular guard. At that time, we really didn't have the understanding that brain is more important, So only after a decade, after 100 years, we started having the concept of a helmet. So we started guarding our brains too. So what I'm trying to say is, the more we understand a brain, the more we can deal with our adolescents, and we need to got them. So this is a functional MRI, a time-lapse fMRI. So you see, the more the blue color, more maturation. That shows the thing. And the maturation takes place from back to the front, from occipital area to the parietal area to the frontal cortex. And the prefrontal cortex is the last one to mature. It is like the front loading of the washing machine. What you want, you really want to front load the machine, because what you want to achieve is the absolute maturation of the frontal lobe, prefrontal cortex, what we are going to see now. So that prefrontal cortex is responsible for the executive function or the intelligence, and it has various functions which we'll be dealing. Whereas the limbic system, which has the basal ganglia, hypothalamus, hippocampus, and then caudate nucleus, thalamus, etc., which is responsible for the emotion, memory, reward, and sleep. These are the major areas, I mean. And because they are in the evolution, they are old part of the brain. The limbic system is old part of the brain, which matures early. Whereas the newer cortex, neocortex, and the prefrontal cortex are newer by evolution, and they mature late. So what happens is, when the emotions are mature early, you can understand the adolescence. So in the early phase, how vulnerable he is, how emotional he is, the mood changes are so much, so fluctuant. He gets angry, he or she gets angry, and we are unable to explain them. And also they are so impulsive. The control is so poor. And the reward, they are all reward seeking. They want lot of pleasure. They take the bikes, and then they drive speed. Speed driving is most sought after, because it gives them so much of happiness. And memory is something we need to tell them. This is the greatest time to increase their memory potential. Some of it is bestowed, some of it is what you can really improve upon. And sleep, there's a lot of studies coming out. We must tell them about sleep. We know, every one of us, or maybe even we have really changed our sleep pattern. What is the thing is, nature is like, we must arise by the sunrise, and we must sleep by sunset, which is not happening. The artificial light has taken over. Then a diurnal rhythm is very, very important, because that is the indication the system inside kicks off. And the various systems, we have a lot of tracks, and it is all governed by the neurotransmitters, which are both excitatory and inhibitory. To understand, because you will be using drugs, and understand what is giving happiness, what is excitatory, what should inhibit. You must know these systems. Non-adrenergic, like fight or flight. This is the basic instinct, the adrenaline, noradrenaline, and the corticosteroids, This is very, very basic. If you see in evolution how our early man had behaved, there's one thing, all his senses are really sensitive to the danger lurking. The minute he senses the danger, either he flies, he really runs away from the situation, or really fights. That's the way our body is made. Next, you have for the living, the serotonergic system, the serotonin transmitter, neurotransmitter, then the dopamine, which has four different nervous system. Mesocortical, which is connected to the frontal lobe, mesolimbic, then to the nigrostriatal, basal ganglia, tuberoinfundibular hypothalamus. All these things are very important because see, puberty kicks off all of a sudden. Nobody has really found out exactly what kicks off the puberty. There are various theories. Nutrition is one, but there are a lot of nervous connection between the dopaminergic system with the hypothalamus, richly supplied, and they also maintain the homeostasis with the pituitary gland. Again, the cholinergic system, muscles, and you must understand our cerebellum also takes some time to mature. That is why the licensing for the two-wheelers is fixed at 18 years. So there is a logic to everything, but you have to tell this to the parents. One is the maturity, the impulsive nature. The adolescent will not know the lurking danger. Another thing is the balance, because the cerebellum is not developed much, so it needs to mature. So they are prone for falls and getting easily injured. So you have to tell them. When we explain to them the reasons, the better acceptance is there. Again, GABA, it's a very important system, and gamma aminobutyric acid, and it is mostly inhibitory. See, this is important because there must be inhibitory system where the neurons should inhibit, like in impulsive activity, the inhibitory fibers need to be strengthened. You can see in attention deficit disorder, some parts and some of the systems are not very strong enough, or they are little underdeveloped. That is why the impulsive nature. And since we already know, Dr. Shanti had said about the plasticity of the brain, they are extremely plastic now. So we can really, if we have understood ADHD and if we catch them early, we can really strengthen these areas where it is weak. I won't say we can really cure them of the problem or whatever they have inherited. We can really strengthen these areas. And understanding is very important. And the plasticity is maximum during this age group, whereas little plastic is there around the geriatric period, but it is a long drawn process during that time. So give the benefit of it now. And endorphin, they play a major role, and they are seen very much in the reward centers. And the other glutaminergic excitatory system is also seen. So there must be a balance of these nervous systems tracks. And there's a lot about the gut microbiome. We know that serotonergic receptors are there in the gut, and the nerve tracts are very much connected to the brain through the extensive neural connections. And when we give this serotonin, sertraline like drugs, which act on the serotonin receptors, in the beginning when you treat them, they have lot of bloating and side effects. That is because they have plenty of receptors in the gut. And the gut microbiome, they are in trillions, and the variety, the normal flora, which we are understanding now. And we also think they have a greater role in the mental health. And our nutrition is going to play much. And please keep in mind, when we talk about the fast food and junk food, if you just say don't eat junk food, and this is not going to be acceptable. Whereas if you're going to say a little bit about the microbiome and then the serotonergic system, and it can help in mental health, there will be acceptance. And we have to be a little permissive too. We cannot have very hard rules for that. So we must consider nutrition at the back of our mind whenever we are going to treat mental health. It must be part of your counseling too. and depression and obesity are really tied together. And one is the low energy level, and eating can really give them more happiness. And then physical activity is going to be low, where the endorphins again will really be at the lower level. So it is all integrated. So we have to have a holistic approach to this. So this is about the prefrontal cortex. Ultimately, if there is going to be a total maturation, there is going to be all this thing, ability to balance short-term rewards and long-term goals. Very, very important. So what is the short-term reward we are going to talk to our adolescents about? Is it about the short-term things on smoking or alcohol or drugs, or are they going to substitute these kind of things with other thing like sport activity, extracurricular activity, being with friends, being with nature? And then attention. So if we are not, we have to see to that our attention, we are going to have our brains healthy to do have a focused attention. And what are the skills we need to do to improve our attention? And organizing thoughts, problem solving, strategies, impulse control, and delaying gratification. On sexual and reproductive health, we need to talk a lot about this thing, especially there's a lot of pumping of all the sexual hormones and testosterone in boys, and estrogen, progesterone in girls. They are very, very physical. The boys are very, very physical and impulsive too. So we need to give them more skills to delay. No, we cannot stop anything. How else can you delay? How can they get themselves distracted into other activities? And modulation of these emotions too, for and better understanding to teachers and parents too. We have to tell them these things are, they will settle down, these things are happening. Help them, guide them to modulate. See, we alone cannot do. The parents need to talk to them because they are going to be with them all the time. And then teachers spend almost 8 hours with the children, I mean, especially the early adolescent period, and they also must be handling them. And then self-esteem issue is a major issue. They can do a great deal for boosting their self-esteem. So this is about prefrontal maturation. I just want to take a short break. I want to say an incident, especially with your professor, Dr. Thenmuri. So when I had a trouble with my son, and there were issues happening in the school. So it was very distressing, you know. Parents, children are their greatest treasures. And I had spoken to the other Dr. Shanti Raj. She said, "Oh, this is nothing, Vijaya. You go meet Dr. Shanti Raj, Dr. Thenmuri. She'll help you. She's very sweet. She'll take you." And she was very busy at that time. Then she spoke to my son. Then she spoke to me, and then she spoke to him alone. And then after coming back, and then he was having small notebooks, you know, and then noting down everything. Daily what he's supposed to do, and then keeping timetable in his bag. And then he said, this time I asked him, do you remember Thenmuri doctor உன்னோட பேசினாங்களே அவங்க என்ன கூப்பிட்டுருக்காங்க? Then he said, oh, that doctor who said who asked me to develop a thick skin. So yes, so you remember. See, that's something from her. It has really made a change in his life. That particular event, we had to change the school, and which was distressing for an adolescent, because he is losing on his friends in the school. Maybe he has a favorite teacher in the school, he misses, and then in the new school, the settling time was really. But her few words really helped him to come out very well. And that word thick skin, she said, like, you cannot expect everybody, all the teachers, to be perfect for you and kind and gentle, or have a soft glove nature with you. Even when you go to college, you will have a variety of teachers, each one would be different. So with some people, you, whatever they may scold, they may treat you differently, have thick skin. You have to shield yourself with that. So that was around 15 years, she said, and he had taken it very well. I found that in many stages. So what I'm trying to give you here is you are going to play a great role in an individual's life. You can make a change, especially when somebody has mental health issues. So, and this is limbic system, and amygdala is the seat of emotion. Hypothalamus, it controls a lot, and sleep is very important. And the hypothalamus is connected to something called hippocampus, very, very important in memory. See, in India is a country where we are talking so much about academic, and the pressure from the parents, peers, and the society is so great. That is only pushing many of our children into this depression. Also, we have some cultural block with our dating and boyfriend thing and romance. So many we have so many blocks, and we have a restriction on talking about sexuality, and even we block the schools from talking about these things. So these are areas we need to concentrate. So hippocampus is a seat of memory and learning. We have to really safeguard, and prefrontal cortex, it has a great connection, and also the cortex, the movement of the body, the rich nerve that is where the physical exercise is going to help us. All the interconnected system is going to boost the neurotransmitters at the receptor level. So to sum up, it is the maturation of the brain which is going to help us, and which is happening, and which is not new from front to back. And it is a period of intense activity for the neurons. And please be aware of the pruning. It is the time of greatest intelligence potential, which goes beyond up to 25 years and even beyond that. So don't judge a person about his IQ, about his other skills. They can be late bloomers, and there is no network connection. We need to guard these connections from the ill effects of drugs, smoking, and other alcohol, etc. Unless we are going to tell them, they must be oriented to that. So we will get some positive effect from them. And behavior of the adolescent is reward seeking. They are very impulsive as well as reward seeking. So from parent side, from teacher side, we must give them rewards always, unconditional love, and always positive remarks from the teachers and the society. You can do, you have done this very well, you can do, that kind of positive thing. And what kind of rewards can be given also must be seen. Potential for high skill building. See, some majority of the adolescents go beautifully well outside. So we have seen, no? So our software engineers, our doctors who have really done very well. See, Indians are respected so much abroad and in many great institutions, and what we have contributed to our country. And the sad thing is we've let down our other little percentage of adolescents. We did not hold hand for them. So this is where we can make a change. And the coordination, it is not, it is holistic. The whole body and the mind must be coordinated. We must take that into consideration. And the neuroplasticity is a double-edged sword. With the plasticity should be to the positive aspect. We should not let, like smoking will be creating more of nicotine receptors and nicotine pathways. And once if smoking is introduced during adolescent period, the adolescent can go again and again into smoking, and smoking is gateway for drugs and alcohol. And we know how fashionable it is to smoke, and of course binge drinking. It is part and parcel of in many homes also now. Even parents take it very lightly, but it can damage the brain. There are subtle effects of the thing. At least you can delay until they become an adult, and then when they have they know when to stop these things. So use it or lose it. This is the time you have to use it. And sleep, very, very important. Melatonin is set 2 hours later for adolescents. Please tell them. So don't expect your adolescents like we do, early to bed, early to rise. That cannot happen. When we talk about sleep, we must also talk about the internet and screen time. The permitted limit is 2 hours for an adolescent. he has to sleep, he or she has to sleep 8.5 to 9.5 hours. That's the thing. Or at least 7 hours, minimum 7 hours. And they have to go through the full sleep cycle. That is very important. During sleep, there's a lot of healing taking place. There is the toxins that is being removed. And also the restoration sleep, 3 and 4, is important for memory building. So one has to really study well, go to sleep. That is all impinged in the memory, and they can retrieve later on. So you say these things when you talk about study skills, they'll be very interested. And also the quality of sleep, life during wakeful state is important during the next day morning. So please tell them these things. And also anxiety, and this graph is very important. Optimum anxiety is important. See, I had two great speakers before me, and really it kicked off, and I was really anxious, better do it on the first day. Here I am. The last day you have such proficient speakers thing. But if I had been really, really very anxious, that would have really stressed me very well, and my performance should be very low on when I do it. So the anxiety level should be optimum to kick off the cortisol level so that we perform well. It should not be on the lower side. Maybe possibility for the depression. On the higher side, it is like sending butterflies, increasing heart rate, tremors, diarrhea, etc. That can be distressing. That is one of the major mental health issues for the adolescents. We have to be very conscious, treat it early. Like doctor was asking, 5 years children also can be anxious, school phobia, refusal to go to school, not eating in the morning, breakfast, refusing. These are all indications the child may have anxiety, so you need to treat them. And also adolescents, the commonest, and a lot of other things are there to treat them. Like, and be conscious, high risk taking behaviors, reward seeking, poor self-esteem, very, very important. Acne on the face, they feel they are not looking good. Watching themselves in the mirror, little weight gain, body image problem is a major issue. We are seeing eating disorders, anorexia nervosa and bulimia. Maybe not the typical one which we saw in Princess Diana. We are seeing a different kind of issues. I have seen many cases in CMC, which is near my home. I've gone and seen, because this is something unheard of in our place 5 years back. But we saw typical changes in the adolescent, simply because you see when you take history, it is because somebody teased them on their body. You're looking fat, like that. It's very important. And teen brain vulnerable to alcohol. So you will be learning in your psychology more about it. So why it is important? Again, 40% in 14 years. Early identification is very important. And mental health, some are permanent, like anxiety, and then ADHD, dyslexia, the conduct disorder, oppositional defiant disorder. These are all the genetic theories are there, or really they are unraveling. But you can manage them. You can manage them beautifully. So you must really look forward to catching hold of them early and treating them. Yeah. And then please understand, psychiatrists don't have a greater role at this point of time. You have a greater role, because drugs should not be as a first line of management initially. But to help them, we need to use drugs too. And understand the integrated system, doctors, psychologists, therapists, speech therapists, physiologists, counselors for our parents, teachers, all must involve in this. And I also want to say a few words about this HEADS psychosocial review. It has been framed by a doctor who dealt with adolescent medicine. Please Google and find out extensively. It is given. See, this is a questionnaire like history taking. It is very flexible. You have to thoroughly take. It's an acronym on these aspects, and then you can see the warning sign. If there is a depression in the history, if there is a depression, you can leave other things and go to concentrate on the depression. Again, if there are issues on sexuality and there's no problems on depression, you concentrate on sexuality. And every one of us must use this HEADS. Just an introduction on this. Please go through it. And a lot of things, this is common much beyond them. And DSM-5 gives elaborate thing on the symptoms and thing. You can take like ADHD, the revised criteria are there. It gives a real good guidelines. We can follow that and pick them up. And these are the things, and a little more on internet addiction disorder. And there are very many classes also in that: gaming disorder, screen disorders. Very pathetic, because it's very difficult to treat. You need a total approach. Yeah, statistics again, I want to point that 15 to 29 years, very bad in our India. We are talking so much about all that culture, and then the family values, how we've landed up. So you can go through that. National Mental Health Survey has come out. They have detailed the descriptions of the various things they've studied. And see, it is increasing. The rates are, depression rates are increasing, and we even observe suicide day. Lot needs to be done on that. I am not going to deal now, want of time. So what are the protective factors? We are gatekeepers: teachers, psychologists, doctors, parents, all are gatekeepers. We must be aware. Role modeling is must. Don't forget to tell that. We cannot just give advice and then learn the brain and give positive reinforcements. And for that, effective communications is very important. Listening. We must listen to our thing, and the listening must be active. And we must use appropriate words to tell them, like depending on the stages. If they are concrete thinkers, you must tell them very clearly in short sentence. If they are abstract, then you can talk little like adults. And physical activity, don't forget to tell them in each and every meeting you have. Physical activity is important. Nutrition and extracurricular activities and hobbies are very important, so that it will distract away from other things, like getting whiling away at that time. See, if they're not performing well in scholastic activities, any good performance in extracurricular activity will give them some happiness. And also, all of us are not made to come under the top brackets in scholastic performance. Intelligence is not just the studies. Sleep, I said, please be aware of screen time. And genetic versus epigenetics. I'm most of you would have seen the movie, in what is that movie, where that thought process, where you integrate whatever you want to say, you keep repeatedly saying, then it integrates in your brain. And once the adolescents start doing it as a practice or a habit, it may be possible that it is passed on to the next generation, a change in self, and then passed on to the next generation too. So always integrate the values and things. And spirituality, if people don't want to follow God or nothing, nature and providence is always there. Support system, we must give support system. Government has to play a major role. We need tertiary level care, sensory parks. NGOs also are playing a greater role. There must be societal acceptance and non-stigmatization of mental health issues. And also for scholastic backwardness, it is a subject on itself, and we need many more remedial teachers, occupational therapy, psychotherapy, speech therapy, and lot more on mindfulness and motivational interviewing, doing a lot of things. And very, very important, motivational interviewing in treating smoking and alcohol and drug abuse, helping a lot. And mindfulness, all of us can start practicing, helping every one of us. Yeah, these are life skills promoted by WHO: self-awareness, effective communication, problem solving and decision making, critical and creative thinking, and coping with emotions and stress. This is not new. See, in those days, Panchatantra tales, like the common thing, the thirsty crow, we teach them in UKG, kindergarten level. A crow, it's thirsty, and it really wondering how to think. Then it thinks, how to solve the problem. then its creative and critical thinking awakens, and it goes, picks up the stones and puts in the pots, and the water level comes up and drinks. So use these things. Every one of us need these problem solving and critical thinking skills. So you can use these stories in your counseling sessions. And this is a picture taken by me at dawn. Everyone's life, when there is setting, it must be as beautiful as this. Daily the sunset, it's beautiful daily. And our life should go on. We have all turbulence, but our life should end in a very beautiful tone like this. Please help all those in need, and let's hold hand together with the challenged mental health illness people. Thank you very much. Thank you very much for the opportunity, Professor Tenmuri. Thank you so much. Thank you. I'll take the questions. I can't hear. Yeah, I can't hear. You have to mute. Mute, ma'am.
Doctor, in
Yeah.
the chat box, there is question.
Yeah.
From Kaushik.
Yeah. The question is, my age is 20. Somehow I feel that we are far away from adolescence thinking. How we overcome the problem, because I think it's my limitation. How we move adolescent mobile centric to social. Okay. See, the plasticity, we're talking about neuroplasticity. So it actually goes even up to 35 years. That's what the study says. We need to understand our brain more. And also it gives us a lot of hope. Even in stroke patients, we regain the motor activity. So the thing does not stop. Don't go by this cutoff value. We can equip ourselves. And to help the adolescents, mobile centrics to socialization, this corona period has taught us a lot. We've come together as family. We couldn't, though most of us are using mobile, we have to guide our parents on these limit setting is very important. So when they are under the control of parents, they have to negotiating is very, very important. And also the American uh, Pediatric Association and our Indian Academy of Pediatrics, we have set the deadline, limit as 2 hours for adolescents. So that can be in any form, screen time. So we have to negotiate and slowly have to bring down. If they are indulging more than that, we have to talk and bring that level. And also socialization is, see, we also restrict them. We don't let them go out for games, for any play activity, for gym. That is the reason we keep them under a guard and not let them. So we have to break that. Sleep pattern, we cannot expect them to follow sleep pattern early to bed. Yeah. See, maximum is, it is better at 11 should be the target. There's no excuse. If they go to bed at 11 o'clock and then 7 hours sleep is fine, because there are so many demands, like exam and stuff like that. And people are writing some exam, what do you call that, academic examinations, where the demands of time are more. So the maximum is 11 is good. They can get up after that, after 7 hours. That is advisable. But if you're, even if that is not followed, they should see to that full cycle happen. They should go into the deep sleep and ask them for history of dreams. So that means they are having REM sleep. So these things should be followed. And sleep hygiene, they should not have screen time 2 hours before sleeping. What they must eat, how they must, their bed should be their total darkness, because melatonin plays a greater role. So all these things must be advised. Sleep hygiene, if you Google, you will get good thing. I think that's all.
Yeah. Any more questions? I would like to just add on for this screen timing, because yesterday also we had a question. I would say if the parents really want to work on to reduce the screen timing, we have to substitute. It's not enough just to say, no, oh, half an hour only is your time, 1 hour is your time, 2 hours is your time. You have to give a substitute for them. Either give your time with a child or a teenager, or you engage them in some activity. Even now with the pandemic also, we have to sit and engage. Like recently, one person was sharing with me, there is only one laptop and all four of them have to use, like father, mother, and the child, two children. So it's like a morning class, the elder one uses because her timing is also like that. And then later the younger child uses, and then the mother uses in the afternoon time, like 3 to 5, because that's the only time it is available, or 3 to 7. And then because she works from home, and the father uses in the night. No, I want to take this as no example. Like you have to work with the children also like that. Father sometime and mother sometime, and engage with somebody else sometime. And I think we have to sincerely teach our younger generation to have a family integration, having a good relationship with the in-laws and the parents, so that these children has people to get engaged in a more positive way. And that is how I would say, no, having a good relationship with the mother-in-law would be better rather than making the child sitting with the, because we all working, we have no time, burdened, especially women are burdened. So let's build on this interpersonal relationship with our in-laws, especially in-laws and the parents, so that the child is positively engaged with all these people. And we have to work on this, and we have to teach our younger generation on this also. This is just my addition. And thank you, Dr. Vijaya Rani, for your wonderful session. I would say, like yesterday, I was thinking, because Shanti also covered a bit of adolescent, because it's a child and adolescent. You made a different perspective with a lot of, where the students, it's very useful. I would say the brain functions from the medical person, medical view, and also the current, very like step by step, very beautifully. It is a very organized presentation, I would say, and entirely different from what Shanti made. So it makes meaning, more meaning. I know, like Shanti's presentation was actually your complimenting your presentation, I would say. Thank you so much. I know you would have done a lot of homework on this, and it is your positive curve, positive stress, which has brought this. Even Dr. Shanti Saira was telling, I'm doing more work, I'm preparing now because we want to give the best.
Yeah, exactly.
But she's told we learned so much, and we also learned so much. Thank you so much, Dr.
Thank you very much
for giving your time. And I think this commemorating this mental health day, we are all coming together itself as a good auspicious for our younger generation and for our nation. Thank you so much.
Thank you so much on my side too. Thank you. Thank you.
So you can leave.
Thank you, Ma.
Thank you. And I take your permission to upload your presentation with Dr. Shanti Sairam also in our website, in our Facebook, so that if you want to go through the slides, can just go through. So if you can send your slide, I will.
Yeah, I will send it. I will send it. Thank you. Thank you.
Thank you, everybody. We can leave now. I should really appreciate the team who worked behind this program, all the conducting the activities and the webinars, and special thanks to Karen. Nice. I'm really happy for the department the way we are working. Thank you all.
Thank you, Mom.